So we're here today to talk about the difference between traditional speech therapy and tactile speech therapy. In traditional speech therapy, if we use the word part as an example, the speech pathologist would say to the child, say part. The child would look at the speech pathologist and say pot. And we know that that's not correct. So then the speech pathologist would exaggerate the R sound and say, no, watch my mouth, say it this way, part. And what we'd find is the student would look at us and simply say pot, the same way that the speech pathologist had said. The kind of rule is that we do this 17 more times and everybody walks away frustrated and angry. And we find that we really don't know what to do. When it comes to tactile therapy, there's a totally different strategy, and so I'd like to explain that here. What's going to happen is when we ask that child to say the word part, we're going to ask them to say it, and then instead of asking them to imitate that sound that they don't perceive and feel the placement that they don't feel, we're going to give them the insertion of the biter and removal. And that's going to develop a position, a mouth position. So we're going to have the child say pa, and then we're going to ask them, now this is not a new technique, but we're going to ask them about lip position, teeth position, and tongue position. So it would look like this. Do pa silently, and the child would do this. And then we're going to say, tell me about your lips. Are they together or apart? Great, they are apart. Tell me about your lips. Are they near your teeth or away from your teeth? Yep, that's what I saw, they were near your teeth. Now tell me about your teeth, together or apart? And this is the important one. Tell me about your tongue tip. Is it up or is it down? Now we're going to ask that child to do that same motion again silently so they can pay attention to what the articulators are doing, and then we're going to ask them to go to the biter position. So it will look like this. Now we're going to ask those same questions, and we're going to give them choices about the location of their lips, their teeth, and their tongue. And we're hoping that the child then is going to do this movement a couple different times to verify that they can in fact feel the movement of their lips, their teeth, and their tongue. After we do that, then we are going to ask that child to do that movement again and again until it's fluid. And once you see it on the lips, we're going to ask that child to say that word out loud. So tactile therapy involves asking the child to describe the movement of the articulators, and that's something that we aren't able to get in traditional therapy.